Usually I do this as outpatient surgery in a surgery center, but it can also be done under local anesthetic in an office setting, depending on the situation. It's not painful surgery. It's usually very successfully localized, meaning you can use local anesthetic to numb it up. In the procedure, what I do in upper blepharoplasty, for example, is I numb up the eyelid with local anesthetic. So that's a tiny little needle, like the same kind of needle you'd use for Botox. It's the second smallest needle commercially available. It's very small, and you numb up the eyelid. I use a special kind of numbing that helps the numbing to spread, so that you can just inject one spot, it'll numb up the whole eyelid. And I measure very carefully the amount of skin we want to leave behind so that people can still close their eyes and have a symmetric end result, or as close to symmetric as possible. So I measure both upper eyelids. I measure what we need to leave behind so we'll be able to close and have a symmetric amount of skin remaining. I'll also often mark out kind of the lateral extent, because as you indicated, a lot of times the hooding is worse kind of out here laterally or in the outer part. And so I'll mark that out and kind of include that in the design of the incision. Then I make an incision along those markings. I remove a safe amount of skin so that you can still close your eyes and look like you. I make sure there's not bleeding happening. I kind of control bleeding and bruising. And then I close that incision with dissolving stitches typically, but other stitches can be used if a patient's had a problem with dissolving stitches in the past, for example.